Hello to all students. In this video lecture, we are going to discuss a condition which is known as overhydration. Just like dehydration, overhydration is also has so many consequences. Overhydration has different names like water poisoning, water intoxication, and hyperhydration. So first of all, we are going to discuss some causes of water poisoning. So the major cause of water poisoning is heart failure or cardiac failure. Due to certain medical condition, our heart cannot pump the blood properly inside our body. So when the blood is not properly pumped, then there is less amount of blood reaches to the kidney where filtration takes place. As a result of water content or fluid content of the body increases significantly, causing water poisoning. The second cause is renal disorder. In case of renal disorders, our kidney cannot function properly and they cannot filter water and excrete out water in the form of urine. So as a result of water increases in our body and causes overhydration. Hypersecretion of antidiuretic hormone ADH hormone, if secreted in large amount, can also reduce the removal of water and fluids from the kidney through urine outside the body, and as a result of water content increases in the body. Large amount of IV medication and fluid. When large amount of intravenous fluids and medication is introduced into the body, when body does not require as such amount of fluids, then water content and fluid content of the body can also reaches to maximum level. Drinking more than 8 liters of water per day. 8 liters of water means 32 glasses of water a day, which is too much amount of water. Usually we need 8 to 12 glasses of water per day, but if you drink a plenty of water more than your limits, then water content of the body increases and can cause water poisoning. Now we are going to look at some symptoms of water poisoning. If we look at the symptoms of water poisoning, the main symptoms is behavioral changes, because water in the fluid, hyperfluidity in the body may damage the nerve cells present in the brain and causing a behavioral changes in the persons. Persons behave abnormally through their talks, through their thoughts, and through their visions and listening. Drowsy and inattentive, nausea and vomiting, anemia and cyanosis, hemorrhage, bleeding from different parts of the body like nose due to the hyperhydration of the body, weakness, cramps, twitching of body muscles, delirium, seizures, coma, and if not treated can leads to ultimately death of the patient. So what are the treatments of overhydration? So first of all, the main treatment is that to restrict the fluid intake. Fluid restriction. If a person is taking too much fluids or too much water or too much juices in the diet, then a person should restrict to lower amount of fluids which are taken by the body. If not, then we have to do diuretics, which are certain medications which are used to remove extra fluids from the body through urine. If it doesn't work, then IV administration of saline can also be used to meet the balance of ions and electrolytes in the body. ADH receptor antagonists can also be used if the overhydration is due to hyperactivity of ADH hormone. These medication can stop the production of ADH hormone and can regulate the removal of water from the kidneys with the help of ADH. So we must use fluids in a moderate amount, because if we use very low amount of fluids, then it can lead to dehydration, and if we use overuse of fluids, juices and water and soft drinks, then it may lead to overhydration or water poisoning. That's all for today.